Hi, I'm Katie. I am one of Blank Children's Hospital's speech-language pathologists that helps with video swallow studies. Today we're making this video to kind of show you guys and give you guys an idea of what happens during a video swallow study. So when you arrive, you are going to enter through the main entrance on the north side of Methodist Hospital. During COVID, when you enter through the main entrance, there's a temp-taking station right inside the door where there's screeners to take your temperature and ask screening questions. Then you'll move right on through and check in at patient registration. After checking in at patient registration, you'll head straight on through down to the T intersection and then take a left and walk down the long hallway of Methodist. Once you get toward the end of the long hallway, you will see a sign with an arrow pointing left for the northeast elevators. So you will turn left and head over to the elevators, which will be on the right-hand side. And you are going to take the elevators down. Once on the elevator, you will take it down to level C. You'll get off the elevator and walk toward the radiology sign. Go through the doorway, and there will be another desk for you to check in at for your video swallow study. After checking in at the radiology desk, you'll be directed toward one of the patient waiting areas. A team member will come greet you and then bring you back to one of the radiology suites. Once in the radiology suite, you will meet a member of Blank's pediatric therapy team. We will have a little bit of an interview with the caregiver that brought the child to this study. We will take any food, drinks, special cups that you've brought from home and come over to the counter where we add barium to all of the food and drink. Barium for this test is usually in powder form. It's tasteless and odorless. So we add it to any of the food or liquid. This is what helps us be able to see the food and drink up on the X-ray to see exactly where it's going during the study. For this test, everyone who is not the patient, including the therapist, the radiologist, and one caregiver, will be wearing lead. The patient does not wear lead for this test to make sure that we are seeing everything we need to see on the X-ray. We will then ask for a radiologist to come run the camera. The child will sit in one of these two chairs depending on age and size. Our smaller patients do sit in this blue chair. And some of the older kids are big enough and tall enough to be seated in the more adult-sized chair. After the patient's seated in the chair, a radiologist will enter the room. A team member will move this camera into position, and this is where the patient will eat or drink food and liquid. This monitor is the screen that we will watch to see exactly where the food and liquid is going. When the patient's in this chair, there are some different things that they may see or hear. So we're going to move the camera so that you can kind of get an idea of what that might be like. This is a fairly quick test for most kids. Immediately following the test, the therapist will review the results and any recommendations with the caregivers. A report is written later that day and sent to the ordering physician. Thanks for watching our video, and we look forward to serving you.